Next, we will discuss IME behavioral health prior authorization processes, IME forms, and general policies. During this transition, the IME will be prior authorizing 3 services: psychiatric hospitalization that exceeds 48 hours, psychiatric medical institutions for children, or PMIC services, and habilitation. No other services previously covered by Magellan will require prior authorization. Please contact the IME Medical Services Unit at either the number listed on the slide or via email to obtain prior authorization for a psychiatric inpatient hospitalization that will exceed 48 hours. Medical services must be contacted within 48 hours of admission. PMIC services are authorized through IME Medical Services by following the level of care process and submitting the certification of need. It is important that members meet the requirements outlined in the Iowa Administrative Code. Habilitation services will be prior authorized through service plan development. It is not necessary to submit an authorization request to the IME. The IHH Care Coordinator will authorize services. The Care Coordinator will supply the provider with a notice of authorization, and it is important the habilitation provider maintain a copy of the service plan and NOA with the service documentation, which should meet the requirements of the Iowa Administrative Code, Chapter 79.3. Effective January 1, 2016, HCBS habilitation providers, IHH, and case managers will be required to submit all critical incident reports previously submitted to Magellan of Iowa to the IME upon discovery of the incident. The IME issued Informational Letter 1601 describing the process for submitting critical incident reports for IHH and habilitation members. The IME has updated Form 470-4698 into a fillable PDF document. It may be completed electronically and submitted via email to the email address listed on the slide. Providers that wish to fax the document may fax it to the number listed on the slide if email is unavailable. Iowa Medicaid timely filing rules are 365 days from the date of service. What this means is the providers must submit a claim within 365 days of the date of service. For claims adjudicated as denials, they must then be resubmitted for reconsideration within 365 days of the denial date. Claim submissions cannot exceed 2 years from the date of service. This was last clarified on Informational Letter 772. Requests for claim adjustments must be submitted within 365 days of the payment date. Claim credits are not subject to a timely filing limit. Exceptions to timely filing include retroactive eligibility. Claims are not submitted within the confines of the date of service, but rather submitted within 365 days of the date the retroactive eligibility NOD was issued. In situations where the primary insurance, or TPL, has not adjudicated the claim within 365 days of the date of service, the claim must be submitted with the statement TPL delay on a paper claim form and accompanied by a copy of the primary insurance EOB. The IME does accept electronic transactions to recoup or adjust claims. Instructions are available on this slide and on Informational Letter 1160. Providers wishing to submit their adjustments on paper may do so by submitting the adjustment form. This form is a cover sheet and must be accompanied by either a corrected claim or an EOB with the adjustment made directly on it. This is an example of the adjustment form available on the IME website. In a situation where the provider wishes to recoup a claim submitted in error, they may do so by submitting the recoupment request form. Providers must include a copy of their explanation of benefits, along with the recoupment form cover sheet. This is an example of the recoupment form available on the IME website. The IME has a provider inquiry form that should be used to initiate an investigation into a claim denial. When submitting a provider inquiry, please include a copy of the claim along with any necessary supporting documentation. All provider inquiries receive a written response.